According to the official statistics, more than 330,000 Americans have died of coronavirus this year, but not everyone thinks that number's credible. Here's the Grand County, Colorado coroner explaining that some COVID victims also suffered from gunshot wounds.
It's the first time Coroner Brenda Bach has felt so frustrated by a cause of death.
These two people had tested positive for COVID, but that's not what killed them. The gunshot wound is what killed them. I had not even finished my investigation
when the state listed the gunshot victims as dying with COVID.
So their underlying condition is that they had 3 bullets in their chests. Now, some state legislators in Minnesota who examined thousands of death certificates in their state say COVID deaths might have been overestimated by 40%. State Representative Mary Franson and State Senator Scott Jensen are now calling for a national COVID audit, and they join us. Mary, you uncovered some fairly bizarre alleged COVID deaths, including a person who was thrown from an automobile in a car accident, but somehow that wound up as a COVID death.
Yes, and what it took was some concerned citizens. Now, mind you, we've heard these stories. This is what I think is happening. But some concerned citizens went through the data practice route and requested those data files. They paid for them, passed them on into my hands for me to take a look at and see what they were seeing. And there was a lot of data there, so I enlisted some people that are really good at understanding data, including Dr. Jensen, to go through those death files. And what I found was shocking, because I was just hoping that it was a myth. But indeed, Minnesota is classifying some deaths as COVID when clearly they should not be. Listen, Mark, we cannot have people dying in motor vehicle collisions, suicide, drowning, etc., and being classified as a COVID death. Our state is locked down. Our kids are now going to have to wear masks while playing basketball and hockey. Restaurants are shut down. We can eat at a restaurant, but it's got to be outside. Today in Minnesota, we've got a blizzard. People are losing their livelihoods. We have the greatest transfer of wealth taking place right now, and we need an audit.
Right. Well, Steve, you've been skeptical about this for about 7 or 8 months now, because back in April, you made the observation that in fact, as a doctor, you were being incentivized to exaggerate the number of COVID deaths.
Well, Mark, you're exactly right. Actually, my name is Scott, but I appreciate that. That's
I beg you. I'm sorry. I'm sorry about that. I'm sorry. That was the last time I met you, I think, was with a fellow called, but you're right. You are Scott. My apologies.
April, when the Department of Health and the CDC decided to change the rules that had been in place for 17 years by encouraging the diagnosis of COVID-19 in situations that we never would have otherwise, they were abandoning their long-held commitment to precisely identifying the inciting or the initiating event that would lead to a sequence of events that would lead to a person's demise. When they did that, they opened the door. And I did make it clear that at that point in time, I was very concerned. I don't know why they would do that. There was no conversation with physicians when that took place. And what we saw subsequently was we saw enhanced payments to hospitals for Medicare patients. And then we saw the CARES dollars being distributed. And once again, the old adage, follow the money. And we saw that if hospitals could somehow hit 161 admissions with COVID-19, that they would be eligible for a $77,000 per admission payment through the CARES Act. And they had to hit that between January and June 10th. So I don't think there's any question.
Go ahead.
I don't think there's any question. Perverse incentives have been created, and it's frankly the CDC's fault.
No, and that's absolutely astonishing. You're right, Scott, and you're also right, Representative Franson, that we need a national audit, because somehow we have wound up with deformed causes of death in Minnesota, Colorado, and around the country. Thank you very much for joining us.